You're good.
Okay, so our study is on learned helplessness and learning to be depressed, and it was conducted by Seligman and Meyer in 1967. So the research question they were trying to answer was, is depression learned or is it a result of outside factors? And the answer to this question would help psychologists create better treatment plans for their depressed patients, and it would also give them a better understanding of whether depression was more psychologically caused or more based off of a chemical imbalance in the brain. Some connections to class. One of them would be Chapter 2, we learned about Skinner's operant conditioning, where people or behaviors that are reinforced will continue to happen. And so on this study, Seligman looks at the responses of dogs to an electric shock, and we can see that every time the dogs fail to escape the shock, it reinforces that they are powerless to escape their situation, even when they have an escape offered to them. And then we also see in Chapter 13 the concept of a locus of control. So if you have an internal locus of control, it's the belief that you're capable of having control of what happens in your life, versus an external locus of control is the belief that other people or an outside force determines your future. And so Seligman's study, when you apply it to humans, you see that it's very dependent on which type of locus of control an individual has for themselves. For expectations that the researchers had, one of them was that the dogs who were first restrained in the original assimilation would not be able to escape when the shock then became avoidable in the second trial. And then Seligman also predicted that dogs who did not experience the inescapable shocks during the first trial would be able to escape them during the second trial.
Okay. The methods used were experimental because it allows psychologists to identify a cause and effect relationship. Longitudinal because the dogs would have no prior experience to shock or restraint, and so that all of the dogs would be in the same developmental stage. And they also use sociobiology because dogs react similarly to humans under certain stresses, and it creates a less complex model for psychologists. The participants were 24 mongrel dogs, 15 to 19 inches high, and 25 to 29 pounds. They were given the same amount of food and water and kept in individual cages. The dependent variable is that they all received the same shock duration and voltage during the testing, and they were all given the previous experiences with the water, the food, and the individual cages. Independent variable is that the dog's individual reactions to shock, whether or not they try to escape the shock or if they continue to stay even though they're being shocked. The apparatus. Dogs were placed into a mesh harness, and so they're held up, and then their head was placed through a panel, and depending on which treatment they were in, if they tried to move their head and their head hit the panel or their neck hit the panel, the shock would stop. And in the second test, the dogs were placed into a box with two sides separated by a panel, and on one side there was the dog received shock, on the other side it was a neutral zone, and the dog could jump over the panel to terminate the shock. All dogs could in this apparatus. This procedure, there was 3 groups, each of 8. The discrete escape group received training in the harness, and if the dog pressed either side of the panel, the shock would stop, and if the dog failed to press the panel, the shock would stop in 30 seconds. There was no harness control group. They had no experience of shock and received no training, shock training. And there was no escape group. There was the same harness apparatus, but if they pressed the panel, they were not able to terminate the shock. 24 hours later, the dogs were placed into the second apparatus, and the light was shining before the shock was administered to warn the dogs the shock was coming. And it was with this test that the psychologists were able to determine whether or not helplessness is learned.
Okay, so the findings, some of the research findings were that the escape group and the no shock groups had very little trouble escaping the shuttle box or making the leap across the barrier, while the no escape group failed to escape, or rather they failed to try to escape up. For the predictions supported, yes, all the predictions were supported because the no escape group gave up right away and the escape group would keep trying to escape. Some later research was Horn and Pritchard's study on cancer risks increasing, and they found that increased risk of cancer came from people that experienced great loss, such as a spouse or occupation. Another is the Good Patient study, research study, that found that patients in hospitals were told to put their faith entirely in the doctor's hands and release all control over the situation, which could lead to learned helplessness. And the third study was the Finkelstein and Ramsey study with the pressure-sensitive baby mobiles. And this study was 2 groups of babies were separated, and one group had a pressure-sensitive pillow where they could control the movement of a mobile, and then the second group had no control over the mobile, so it moved randomly. And after exposure to the pressure-sensitive pillow or the no-control pillow for 2 weeks, with 10 minutes a day, the control pillow group learned to control the mobiles, and the no-control failed to learn it. And another study is the Breaker study of September 11th attacks, and this showed that people showed high learned helplessness because of the September 11 attacks, because they had no control over the situation.
So this was considered a landmark study because it linked depression to learned behavior. So depression isn't just a chemical imbalance in the brain, but your life experiences and how you handle those experiences do play a role in how depression comes about. And then also Seligman's study adds to the importance of personal control, so that idea that we can always change our situation or have some sort of influence over the situation that we're in.
Limitation. Depression is also biological, it's not solely learned, and there are different levels of depression and different severities. For example, somebody who experiences gets laid off on their job may experience some mild depression, but somebody who perhaps loses a spouse or undergoes a severe traumatic event would probably have a worse experience of depression.
And some criticisms of the study. One criticism is that the treatment of the dogs was very unethical, shocking them for long periods of times with high voltages. And another criticism is that learned helplessness is worse in humans, has much higher those consequences in humans than it does in dogs. So the study is not as accurate as we believe.